The Ministry of Health says it has partnered with investors to ensure HIV patients access much-needed drugs. But even with easier access to drugs, the country is still grappling with how to get more Kenyans tested and know their HIV status. This, the ministry says, is the biggest impediment to achieving the UNAIDS set goals on HIV testing and treatment.
The medical fraternity gathered to unveil new guidelines for HIV testing and treatment in the country and to review whether they were aligned with international set standards. In 2014, the joint United Nations Programme on HIV and AIDS, UNAIDS, and partners launched the 90-90-90 targets. The aim was to diagnose 90% of all HIV-positive persons, provide antiretroviral therapy for 90% of those diagnosed, and achieve viral suspension for 90% of those treated by the year 2020.
With that, then, we can liberate communities and channel them back to the Ministry of Health and make sure that we deliver on the 90-90-90 targets in 1.5 years' time.
With about 50,000 HIV-related deaths reported in the country, the ministry believes that the key to dropping these numbers is via testing. This will expectedly reduce new infections by 75%. The mortality rate is expected to come down by 25%.
If we adopt a targeted approach that considers the locations and risk profiles of the population, we will avert 1.1 million new infections and 760,000 deaths.
The ministry says to achieve the 2020 goal, it will partner with various organizations to build the capacities of healthcare workers, to equip them with skills to offer critical services such as voluntary medical male circumcision as a preventive strategy among men. Leila Mohammed, NTV.